Welcome to another episode of Health Matters with PA Lynn Szabo. And our special guest today, we have Sunny Baker, who is the program manager overseeing the Tobacco Use Prevention Program, or T.U.P.P, with the Del Norte County Public Health. How's it going, Sunny?
Thanks for coming. Thanks so much for coming.
Thank you so much for having me. I'm so excited being here talking about the upcoming events, Great American Smokeout.
Yay. Then when is that going to be?
It falls on third Thursday of November each year, and this year is on November 20th and next week.
Awesome. And what exactly is it? What background, and how can you explain it to us?
Yeah, Great American Smokeout started like in the 1970s by the American Cancer Society as a simple challenge to encourage people who smoke to quit for just one day. Over the year, it has grown into a nationwide movement, promoting quitting, offering resources, building community support for people ready to make a positive change.
Awesome. It's one of my favorite things to mention in the exam room about this time of year also. So for people who's smoking, I think has something to do with their healthcare problems. I'll bring it up. So what else can you tell us about it? What should somebody plan to do if they want to take part in the Great American Smokeout?
Yeah, so I think it's why do we participate in the Great American Smokeout? I think, first of all, we have to think about the smoking remains the number one cause of preventable death in the U.S. It is linked to heart disease, stroke, and lung disease, and many types of cancer. In fact, smoking causes 3 out of every 10 cancer deaths, and lung cancer remains the leading cause of cancer death in our country. But good news is quitting works, and the benefits start almost immediately. So 20 minutes after quitting, your heart rates and blood pressures begin to drop.
Right.
And 12 hours after quitting, carbon monoxide in the blood drops to normal.
Awesome.
And 24 to 48 hours, and you're able to smell and taste. And
That quickly?
yeah,
I didn't know that.
quickly. And,
Wow.
and health benefits just, and as you over the years and just quitting smoke helped dramatically, the reduced risk of disease.
Not only for the smoker, but I would imagine the people around them, say if there's kids around them.
Absolutely. Protect the loved one, especially children, from asthmas. And also,
What are the dangers of secondhand smoke with that? Because there's a lot of people who smoke, but they're like, I don't smoke in my house and I don't smoke around the kids, but it's on you, right? Isn't that right?
exactly, the secondhand smoke, as harmful as the smokers,
And
right?
it's more than just on you. Everybody tells me when I'm in the exam room, if I ask, does anybody smoke around this child? They'll say things like, well, I have a different coat, or I always wash my hands. No data that I'm aware of that tells me that makes any difference. Really, the smoke in your lungs, they're like little buckets. And if you go into your house, if you smoke outside and then you go into your house before 13.9 minutes have elapsed, you are 2 little buckets of smoke bringing it into the house.
Oh, you're kidding.
And
13.
13.9, I call it the 15-minute rule because I think people kind of cut it short because, the kids are pounding on each other or the dog's causing a problem or something. And they go back in a little bit early. So 13.9 minutes, what science tells us, but real life is about 15. And as far as I know, and I don't know, Sunny, if you know anything different, I don't think a jacket makes much difference. I know people really want to help, but I don't think that's the way to do it.
And also, you have to think about the mental health, the stigmas and the shame and guilt,
Right.
affecting our children and loved one. Not only children, the animals we love and dear. What about the environmental impact as well,
Right.
too? So it's all interconnected.
So-
So quitting does really make a positive impact immediately on our health, but also our loved one, our environments make a positive impact as well, too.
Sounds like it.
Yeah, improved mental health is huge win as well too. Relieve your stress and anxiety.
Right.
right? And also boost your self-esteem. Your confidence is good, and you boost your energy level as well to bring lots of oxygen to your lungs and muscle,
Right.
and give you strength,
Right.
and give your energy back to you, and give you life, literally improve your quality of life.
Yeah, I think you alluded there when you said about the environment, you alluded to third-hand smoke, which is a thing that we're only recently becoming aware of as a problem.
Wait, third-hand smoke? I've never heard
Third-
such of a thing.
Oh, third-hand smoke is what seeps out of the walls.
Oh, yeah.
Yeah,
Yeah, that's really gross.
it is gross, and to solve that problem really requires a tear down to the studs.
Yeah,
in
it's
the
really.
walls.
Both of my grandparents smoked in their house, and they both smoked more than a pack a day. And so 60 years later, when they both passed away, and trying to clean up the house, and he was scrubbing the walls and painting, and then or the primer, it just seeps through. Years later, it would still seep through with the nicotine. It was
Right.
gross.
Right. Yeah. So that's a great expense and a decrease in property values, I would think.
Absolutely.
Yeah.
I'd just like to touch base with you about the Tobacco-Free Del Norte Coalition. We have a
Yes.
coalition, the members, dedicated citizens who really deeply concern not only our health and environment, and also the most vulnerable population who lives in multi-unit housing. So last couple years in both county and city, we passed ordinances, smoke-free multi-unit housing ordinances. That is a huge win. I need to shout out how we as a community together, we show concern and voices about this secondhand, third-hand smoke and harm and dangers to especially children and vulnerable people. And we see now that benefits and a positive outcome from that ordinances and policy-driven action.
Absolutely.
What exactly is that ordinance? Is that you can't smoke out if you live in multi-unit housing? You can't smoke outside of your home or in it?
Just inside,
Just
in the
inside.
multi-unit inside, and within 25 feet, I
Right.
believe.
Okay.
And from the balconies, and protect those who children's
Gotcha.
and the pregnant women's and the young and also older and elderly, those vulnerable populations, their lives can be safe.
Yeah.
And it's a huge win, as people and come together, we pass ordinances. I just wanted to shout out the Tobacco Free Del Norte Coalition, the awesome policy driven in action. It
Nice.
does work and save life.
Yeah, makes my job easier, so I appreciate
Oh yeah, that definitely does. Yeah, we all do take a part.
Right, exactly. So one thing I think that we should add here, and I don't see this talked about very much, but as far as health consequences of smoking, there's, now correct me if I'm wrong, there's a high incidence of cigarette use in Del Norte County. Is that true?
It is true.
Yeah.
So the 2024 data shows about almost double as the state average.
Okay.
Nearly about over 17%, I would say, around
Wow.
that rate. But last year we did conduct the community health assessment.
Uh-huh.
It's called CHA, and through that assessment, we conducted a community survey over about 400 residents, voiced about the health behavior around the tobacco smoking. About nearly 30% say they use tobacco products that include vaping.
Oh, vape.
So that's
Yeah.
really increased that another the issues we are facing, especially vaping on the youth. But overall tobacco rates and vaping rates is almost double as the state average. So
Wow.
it's huge issues we are facing.
Why is that?
I would think a lot of reasons, the overlapping. So one of the main reason is, of course, is mental health is a big reason,
Right.
and also stress, and we've been through, and geological isolation, and that is another thing. And also the cause and reason is varying among the population group. Of course, the youth is mostly stress and triggers, and also social norms, and also social peer pressure is a big, and we don't really see a lot of data sets coming in our region, but we know that social media does play also the role as well among our youth, and also the lack of positive role model, I would say,
Right.
especially the male the figures and the father's presence lacking at home environments.
Right.
And a lot of things overlap, interplay about the reason why. But among the older population, I think loneliness it shows, and the survey shows an isolation, loneliness, and social determinants have, which means like social factors like poverty, lack of resources,
Generational
and
acceptance.
exactly norms, social norms,
Right.
and generational poverty
Right.
trickle down. Their generational, the norms
Right.
display at work.
Yeah,
In
that makes
community,
sense.
in society,
If everybody in
and
your family
school,
smokes, you're going to try it
smokes.
too. This is what we do in our family.
Yeah.
Absolutely. So it's a huge issues we are facing. We see the great wins like the smoke-free multi-unit housing and tobacco retail licensing ordinances, and we still come voice strongly, but we still see a lot more needs and collaboration working through the system level with the schools and communities and citizens and decision makers, and we all need to come together and work together to voice it, creating a tobacco-free community.
Yeah.
I also wanted to add that chronic pain, there's a lot of people with chronic pain issues in this community, and especially with the misuse of opioids and kind of the medical providers' correction on how they prescribe opioids. I really want smokers to know it's harder for me as a healthcare provider and also my colleagues to treat chronic pain. And people, it kind of makes the tobacco users suffering in two ways. Number one is maybe lung disease and cardiovascular disease and cancer risk. But the other one is that physical pain is harder to take care of. And I don't think people know that. I really don't. And it's always sad to me when I'm talking to somebody who is really suffering. I'm not able to offer them much, but inside my soul is screaming, get off the cigarettes. That would be a step forward.
Wait,
So-
I have a question. Are you saying that the physiological effects of smoking increases your pain sensitivity, so you're not responding?
I'm also saying that you can't really respond to any treatments as well
Oh,
because it's kind of blocked. And that's a real simplified overgeneralization probably, but I don't think people realize that.
I had no idea.
And they suffer because of it, which is sad. I don't think providers say that much.
No, and that's the first time I've ever heard of that. And if you don't mind if I ask a follow-up question, Sunny, you were talking about people start smoking for stress and to relieve those stress and those types of things. I've heard recently that nicotine actually causes feelings of anxiety and those types of things. So what we think we're doing to relieve anxiety and our stress is actually feeding into it. So it's not the relief we think we're getting. Is that true, or is that just...
That is absolutely true. I think excuse me, they might be just a short, immediate relief of your pain, but actually it just worsen your depression, anxiety, mental health issues it worsen your mental health issues. So the seeking mental health support is critical parts of this journey of quitting. So we all know that quitting is hard.
Yeah.
Nicotine is addictive substance.
Right, so now you've increased your anxiety and your stress that you're trying to get rid of, and now you have a physical addiction and a psychological addiction, it sounds like.
Absolutely.
Okay.
So the quitting is the number one.
And this is not just with tobacco, cigarettes, this is with vaping as well? Or
Absolutely.
so it's the nicotine in and of itself?
I would think is
Yeah? Okay.
Nicotine.
Lynn is nodding her head, so...
I think that's the primary chemical of concern. But we have to remember in a cigarette, there's all kinds of carcinogens. I don't know if you have the data, but I've read 3,000. Is that?
That
seems
I
like a
don't
lot.
have the numbers off the
Okay.
bat right now, but yeah, that's
Yeah.
like hundreds different
Surprisingly
kinds
high.
of chemicals.
It makes
Right.
sense. I mean, it's a plant-based thing, so there's and then you have all of the chemicals you spray on those plants and everything else. They're all broken down. So if you broke it down by...
Well, you have stuff that's put in from the manufacturing of a cigarette. Okay, so the papers and the filter and
Yeah.
and you're breathing it directly into your lungs.
Right. And then you do the vaping and you have the flavors or the mint or
Right.
you have this or you have the thing to make it thinner, to make
Right.
it burn this way, to make it
Right.
vaporize in your lung and not turn to liquid.
Right.
Yeah. I can't even imagine the engineering that goes into that.
Yeah, nicotine is a poison.
Yeah,
It's just
used as a
and
pesticide.
yeah, a highly addictive drug that harms
Right.
your developing brain, especially in our youth. So, Tobacco Free Down North Coalition really focusing on our empowering youth through this policy-driven change and also education. I think that goes hand in hand, education, policy-driven inaction through the system change. But again, role modeling, encouragement,
Right.
support is we need to believe, we need to hopeful, we need to stay positive, acknowledging that quitting is a journey, not a one-time decision. It might take several attempts,
Right.
many attempts to get to the point, but it's a journey of that healing.
Is that where the November 20th, the day to have the Great American Smokeout, like this one day, you go one day without a cigarette, you can do it, to kind of lead you to see that you can go one day, now you can go two. So just to get you started.
Exactly.
That makes sense.
That's exactly
You're tricking
how.
our brains there, Sonny.
Yes.
Well, actually, I have a question about that, the timing of it. I talk to patients a lot about doing a New Year's resolution, like a real New Year's resolution, like not deciding it in a party situation 10 minutes to midnight that you're going to stop smoking, but to think about it a couple months before and to line up the ducks and to get the information. And it seems like if you have a practice day for one day, then you can say, okay, so that went okay till 3:00 in the afternoon, and then this is where it broke down. And then you can start to put together a plan that's meaningful. And then New Year's is just a convenient, culturally acceptable day to make changes. So what could they do to kind of move forward in the plan if they decide they're going to do the smoke out for one day? They figured out what was easy about it, what was hard about it. I would think the first thing you do is call 1-800-NO-BUTTS.
That's
Is
really, that's a great
Yeah,
the
or
call to action.
one of the tobacco helplines. Do you have some other helplines?
Yes, absolutely. Yeah, you mentioned about that New Year's resolution. It does require commitment, resolution, some sort of like, I'm going to do this. This is the day I'm going to do it. But support is available, resources available, and definitely reaching out to the support system and resources is the one of the after you commit and this is the day we're going to do Great American Smokeout is the day, I choose the date. So I think having those plan in place, starting with the quit date, set the date. Today is the day. And also tell your friends and family to
Yeah, they do need a warning.
They do. Tell them, asking for support, for support, And also, after you set your minds, the dates, and then having those resources, what's resources available? And 1-800, it definitely is that one of the hotline. In California, can access free telephone counseling at any time, and also 1-800-300-8086. And also in California, we have a really great resources. It's called Kick It California.
Okay, what's that?
Kick It California is a free resources for all Californians who are ready to quit. So they have website and also hotline and helpline and also free app. And is available for ready to do it. So you can make a phone call to Kick It and the website, kickitcalifornia.org, or call 1-800-300-8086. And also text to quit or vaping to 66819. And those helpline is a great way to start. And
So they even have the texting now. So for those who don't want to talk on the phone, so all of those neurodivergents or text or talking avoidant people, so you can just text it.
absolutely,
How about
you can just
people in
text them.
Oregon? Do you think they have something comparable? Because it's possible this broadcast could be heard in Oregon.
Yeah, this is just hotline to American Cancer Society. Society has nationwide telephone hotline. Quick line is available as well.
I think part of the West Coast Health Collaborative after the CDC abolished most of its things is to share those resources. So I think
Right.
if you're whether you're in Washington or Oregon, Idaho, if you're over on this side, Hawaii, you can call that number. You can use the texting service. I think that's part of the collaboration that they're doing.
Awesome. I
Yeah.
would also add, oftentimes to get prescription meds, and there are an increasing number of those available, you have to have talked to one of these helplines first before you can get your insurance to cover it. Also, you should loop your provider in on this. And for people who are like, yeah, my provider smokes too, or I can't get in time or something. The acute care clinic on Saturday is the time when I'm willing to talk to people about it. And I can, prescribe patches or gum, or there's actually other medications. I think naloxone is a choice, Wellbutrin is a choice. So there's things out there that we can help and we can refine what might be best for the individual.
I've heard of the patches and the gums and things. What is the Wellbutrin and the Lanoxone? Is that what you said? What are those?
Naloxone. Let me even step into the medical library and check.
Oh, she's got to go into the library. I feel like going.
That's my brain. Well, Wellbutrin has actually been available for a long time. And I don't think
Are these like Chantix drugs or no?
No, it's not Chantix. It's a different type of antidepressant.
Oh, okay. Yeah.
There is a Chantix, it was available and then it wasn't for a long time, and now it's available, I think, in a generic form. So that's possible, but some people have really got help with that, and some people have not. Naloxone, I'm less sure about. I'm going to jump the gun on that. But naloxone is used, might be primarily alcohol, actually. But if you got one problem, you might have two. So,
yeah.
But we could clarify that in the exam room and kind of focus on what the individual might need.
Okay.
A lot of people are very successful with the gum.
And this is just something for a little bit of support to get you through the worst of the withdrawals, or is this some medication you have to take forever to stay off of it?
I think a lot of people use it as a forever drug, but really it's meant for short term.
Short term.
Because
Okay.
nicotine is going to cause problems whether you're smoking it or chewing it, or you have a patch.
Yeah. Yeah. And I absolutely love the idea of telling, I made the jokes about the warnings of telling your friends and your family that you were quitting smoking, but having that accountability of having somebody call and check on you and say, hey, how were you successful today? Okay. There's always tomorrow, or I'm really proud of you. And to have that support when you can't do that, we're pack animals when it comes right down to it. We need each other. We need our sense of community and those types of things. So I think that was phenomenal.
Absolutely. Yeah, encouragement, support, it's a really important. And also, the research shows that using more than one method of tobacco treatment is associated with higher rates of quitting. So the combination of receiving counseling and using nicotine replacement products such as patches or gum has proven to be most effective way to quit for good. So it's a combination of the proven method.
Right.
Wow.
One of them is coaching, counseling. So that's a Quick It California is offer free counseling. So the minute you call or text, there's a trained quit counselor is going to be check-in with you, call or text, whatever method you want. They will have up to 5 or 6 sessions of those kind of counselings or coaching to help to develop your personalized quit plan after
Wow.
you set the dates. And it's good to have those plan and those free app for, access to free materials and resources and motivational tools. And you can stay on your plan, stick with your plan.
It's almost like the world is rooting for you.
Yeah, it sounds like it.
Can you tell us what's in this quick cut?
Yes, a quick
Yeah.
A quick hit.
quick kit.
Okay.
So we have in the public health, Delaware County Public Health Tobacco Use Prevention Program has this quick kit. It's available. I like to go with the contents in here. In your quick kit has a lemon lime water enhancer. That staying hydrated is important and help to calm cravings. Adding fresh fruit or additives can make the drinking water more enjoyable. And you can find lollipop. Part of quitting means breaking your hand to mouth fixation.
Awesome.
Lollipop's a great way to address this and help manage cravings. And you can also find a mini notebook and pen. Journaling is a great way to ease stress and anxiety. The mini size of this notebook make it easy to have on the go. Write down why you want to quit and return to that list whenever you have a craving. Mint candies, quick and discreet tool that can provide short-term relief to manage cravings, reinforce the goal of staying tobacco and nicotine-free. And tea bags. Cravings typically only last 3 to 5 minutes, get weaker and less frequent with time. Drinking tea or warm, comforting beverages is a great way to curb your craving. Take a moment to go to ground yourself. Texture stickers. Texture stickers relieve stress and anxiety. Give your hands something to do when you have a craving. Place the sticker on something you often have nearby, like your water bottle or phone, and rub it during cravings.
Oh, that's great advice.
Yeah.
I would add that the kits that we get for the Native community also include beading projects and things to keep your hands busy, your mind busy, and kind of off the cravings. So people could go out and maybe get some kind of hobby that they do or thing that will keep their hands busy.
Yeah, so it also contains there's some resources and educational materials to go with it.
Where does one get a quit?
And you can call to Delaware County Public Health.
And what's your number?
And our number is...
We have so
Our
many
number-
resources here, it's hard to
Yeah,
get
we
through.
do have a lot of resources. Just start with it. Delaware County Public Health T.U.P.P program, 707-464-0861. And we are here to provide quick kit, encouragement, local resources, and connect to the resources that is available we just mentioned.
Nice.
So, yep. And also like to invite you, Tobacco Free Download Coalition. We meet monthly via Zoom. And our next meeting is November 18, 9 to 10 a.m. And we wanted to, our community participate in the coalition meeting.
So anybody can just join in that Zoom meeting?
Anybody's welcome.
Awesome.
That is awesome. And that's going to be on the 18th, and then the Great American Smokeout is on the 20th.
Correct.
Okay.
Really cool. Thank you so much, Sunny, for joining us and talking about this important day. I have to say, as a healthcare provider, I don't hear much about it in clinic, but I'm going to be talking about it all this week. And hopefully, maybe it'll help one person. For even if it's just a little while, it's still a great thing. I know this is hard, but the benefits are awesome and amazing, and I really appreciate you coming here today to talk to us about them.
Thank you so much for having me. Thank you, Lynn, and thank you, Heather.
Thank you, Sunny. Thank you for participating in this episode of Health Matters with KFUG Radio. If you'd like to listen to this episode again or any episode of Health Matters with PA Lynn Szabo, you can always go to the YouTube channel, hit the playlist, and search for any topic that you'd like.
Yeah.
Thanks. I'll see you guys next week.
Awesome. Thanks. Bye.
Thank you.